on particular side managed to be treated as a physician because he's continuously changing catheters. It's one of the most less accommodating things that you face with having just to every so often change the catheters on these gentlemen. And it's important for us as parents, and it's important for us as children of parents who've got benign prostatic hypertrophy or prostate disease to understand the delicate nature of this whole disease process. It happens around the genital organs. It happens to produce a high smell. It happens to make you feel less appreciated as a person because you're unable to control one of your excretory products, which we were able to do before. It's concomitant to the fact of passing stool on yourself, the odor associated with it, the inability to deal with it, the fact that this was something you were able to take for granted. That person, whether it be your parent, will not want to leave the house. They'll become very depressed. They'll become very, very introverted. You will start to make remarks about them. So it's not only the disease process per se that influences the behavior, it's the nature of the disease process and it affects us. This same particular person can have prostate cancer with evidence of radiation implants, and you will never treat them the same way because you don't have to deal with the urine, you don't have to deal with the feces. It is my important message to you, if you find your father on this Father's Day having prostate disease, at least go with him to the doctor for further explanation. I will tell you, my father did have prostate disease, but I took care of him at the time when it occurred, and I'm ever so grateful to be able to say, this was my father, and happy Father's Day to all of you. Your fathers are alive, and for those who have lost their fathers, be appreciative for the fact of the education and the inspiration that they gave you throughout your lives. Never forget your mother, and this is mine, which I will never forget because basically they were the cornerstones of our lives. Happy Father's Day for all old and new fathers. And I would like to highlight some of the disease processes that I saw in my father, but I think it's one of the common ones I see today as well. A lot of times patients come, doctor, I feel a numbness in my arm. Is this the numbness in my hand? Is it a sign of stroke? Do you have high blood pressure? Yes, I do have high blood pressure. Is it a common thing just to have an isolated numbness of the arm as a reflection of a stroke? No. And I'll go back to my father as well, because this is how we presented over 12 years ago. He passed away 10 years ago, and his memory is still very much alive. More so that you should respect those of your fathers as well and keep their memories alive forever. A common condition we tend to see is carpal tunnel syndrome, which is compression of the median nerve. The median nerves, let's look at that diagram, supply sensation to the thumb, the index finger, the middle finger, the ring finger, not to the small finger. The median nerve itself runs through under the flexor retinaculum and basically can become compressed. But one of the signs that brings a lot of patients to the doctor, I've got numbness over that part of the hand. In the case of my father, he had high blood pressure and also had carpal tunnel syndrome. So when he presented with a numbness, it was recognized it was an early sign of carpal tunnel syndrome. But what did the impact of this have on him? It produces a weakness in the hand. So much so he was unable to grasp the stereos going up and fell backwards and then sustained a fracture to this area of the bone, of the distal Achilles fracture at distal end of the radius and around this area of the radius. And actually that resulted in him now unable to grasp anything. And that was one of the sequence of events that elderly patients tend to suffer with. You get the high blood pressure, you get the numbness, you're not quite sure how to grasp what strength you have, you trip and fall, then you complicate it with a fracture. And that's considered a cascading set of events from one small disease process to the next. Me explaining what it is to you, it's sometimes the diagnosis is important, but the impact of the diagnosis and the impact of having the disease process from something as simple as carpal tunnel where the median nerve can become compressed, trying to get a nerve test to elucidate what it is, or just clinically telling what it is important enough. But it's also to recognize that the patient needs to be informed that basically that can cause weakness in the arm. So you have to be very careful as you climb upstairs and how much pressure, because it will create weakness. if you notice when the median nerve is becoming compressed, it is going to lose some of the the blood supply to it. And when you lose blood supply, you will develop a tendinitis, you will develop a decrease in the neuronal, the demyelination of the myelin sheath, and the nerve itself will not be able to conduct impulses of the way it should be, and hence you lose the strength in the arm, because this depends. It depends on the strength, the nerve supply of it, depends how many impulses you can get to cause the contraction of the muscle itself. And the numbness itself can also cause you to develop a weakness and unable to sense of grasping. Now, when you get the carpal tunnel syndrome and you're still wondering whether or not this is high blood pressure causing me to get a numbness or a stroke, it's also very important for you to realize that you need to get it diagnosed. And there are a couple of other things that can make it worse. Repetitive trauma to that area, whether it be from typing or whether it be from jackhammer trades or people who do a lot of heavy lifting as well, can cause swelling within the area. When it causes swelling in the area, the median nerves, which runs medial to the extensor pollicis longus, to the flexor digitorum here, can actually cause numbness over this area. And that is exactly what you should try, either a physician injecting it and restoring back, or at least get a nerve test. And sometimes you need surgery in order to replace it. But when you actually get carpal tunnel syndrome and you're causing weakness of the arm itself, then you trip and fall, you can sustain fractures to other parts of your body, as in my father's case, a fracture the distal end of the radius. Then he had to be in a cast for 6 weeks, hated to be in a cast for 6 weeks. It caused a cascading set of events in which you become depressed over it, you feel less functional, and all your disease problems, you're not able to take care of yourself, you're not able to put on your pants properly, you're not able to button up your clothes properly. Now, these are the kind of things that sometimes we get our parents presented with something that's minimal, and we say to them, well, you go to your doctor and find out what's going to happen. They go to the doctor, well, the doctor say, I have carpal tunnel syndrome. What is carpal tunnel syndrome? I don't know what it is. What is he doing for you? I don't know what he's going to do for me. What did he do for you? Nothing. What can be done for it? Well, here's where you need to pay attention to what you do. Because if you were there with the doctor, at least you could understand, if this weakness, if this numbness leads to weakness, here is the impact that's going to have on your parent. They're not going to be able to climb the stairs, as in my father's case, and you can trip and fall, getting a worse injury. You're not going to be able to hold the bar within the bedroom, within the bathroom, and you will not be able to sustain yourself, suppose you slip and fall. Now, from a simple thing like carpal tunnel syndrome, because your hands are so important to you, you got a fracture the hip. You slip and fall, you sustain a fracture the lower back. You sustain soft tissue injury. In a case like that, you have to be hospitalized. You're in bed, you develop deep vein thrombosis, then you develop a pulmonary embolism. From something as simple as this, what I'm highlighting to you is some of the things that you will commonly see in my 19 years in Richmond Hill and my 11 years of practicing elsewhere. Now, basically, the 30 years of practice have taught me nothing is too trivial for your parents to explain to you. And you, being the person who was more educated than they are, should be able to put it in perspective. If your doctor says you got carpal tunnel syndrome and you're getting the numbness, it's much more important for you to say, why do they have carpal tunnel syndrome? But much more important, how is this going to impact on them should this get worse? And then you're able to get the true picture from the physician, what it is going to happen in the event of your parent unable to grasp properly. The same thing happens. You get Bell's palsy. You got a paralysis of one place. It is not life-threatening per se, but the impact it's going to have on you in terms of the disfiguration of your face makes it so much important that you understand what the disease process is going to be. A lot of the things in medicine has to do with you understanding what the disease process is, but more importantly, for you to take that information and pass it on to the ones you love most of all. And on this particular day, I hope it's our Father. I hope we can pay them the respect they deserve. I hope we can appreciate them whilst they're alive. I will ask you there, for those of you who have fathers, give them a hug, because it may very well be the last hug you can give them for this Father's Day. I hope you have them forever in your lives. I lost my father 10 years ago, but the impact he has in my life is still phenomenal, and I do miss him every day. Not because he helped me in my practice in the early years, but because of the simple fact of the discipline and the education he gave me as a child. To all of you fathers out there, a happy, a healthy Father's Day. May you enjoy many, many more Father's Day to come. But may the blessing of God be on you, so at least you can be appreciated by those you've given the most of all to, your children.